Piqua Family Practice in Western Ohio just received a Medicare incentive check of $36,000. This is because 25% of the 8,000 patients they serve are on Medicare. 5 years ago, they switched to an electronic medical records system, and now they say they would never go back.
It makes it faster to find the records. We don't have people spending hours looking for charts.
Dr. Landis can say, get into John Smith's chart, I can look at it and we can have a conversation without, having to be in the same room, having to be over his shoulder, he's over my shoulder.
An electronic medical record system means no more searching for paper charts, easier workflow for the office staff, better and more accurate care of patients, and financial savings for the practice.
It used to be a lot of fumbling through the paper charts trying to find the testing, and now we can just pull up and it says testing or imaging, and we can just pull it up right away. As for before, we were flipping through hundreds and hundreds of papers trying to find that test.
Okay.
When it comes to benefits, financial savings top the charts. Electronic health records save time, reduce errors, and speed up insurance claims.
The way that Dr. Lorenz and I do our notes is we do them at the time that we're seeing the patient. So if I am recording it and then looking at what the generated charge would be, that is going to capture probably some missed charges that we might have otherwise.
Go to the individual insurance carriers' websites, we can then see where our claims are, or if there's a problem with one of them, or if it is being paid, or how it's being paid. There's just so much more information available, as opposed to being on the phone and waiting for your rep, insurance rep, to answer all your questions. It's just a great advantage.
Now, the doctor's order for tests and lab work can be sent to the lab before the patient even leaves the office. Alerts appear on the screen to remind the doctor to do regular checks, such as an A1C for diabetic or a cholesterol check. With an electronic medical record system, in the end, it's the patient who wins.
Communicating with the patients, I think, has been better too. We have a website portal, and patients can contact us via email with questions, and within reasons we can answer those, but also we can send information back to them. So their lab tests, I think, actually get back to them faster.
And the patients seem to really like it. We offer sick call at 7 o'clock in the morning, 4 days a week. You can walk in with no appointment, and we see acute sore throats, poison ivy. They can walk out of here, and we have a pharmacy here in town that opens at 8 o'clock. They can leave here at 7:30 and pick up their prescription and be on a medication by 8:30 in the morning, which is really helpful if you've been up sick all night.
For those practices that are still intimidated by going paperless, Piqua Family Practice gives some advice. Don't be afraid to make the switch.
Well, I had never touched a computer before when they came in here, and I thought, I cannot do this, I'm not going to do this. I was afraid I was going to delete things and wipe things out, and really it's almost impossible to do that. You can always get it back somewhere. And so my advice to them would be to give it a try, and it is a lot easier.
I'd say to be very patient, because it's a lot to learn, and it's frustrating because you're trying to take it all in, and there's a lot to learn, so you just got to take your time. You've got to be patient. You've got to be willing to help each other.
Yeah, I was way more apprehensive about the whole process. And we did not stop seeing patients. We did not ever shut down. I know there's offices that have shut down to do their training. We never did. We worked through it.
The electronic health record federal program is only going to last a few years. Then, Medicaid and Medicare incentives will be gone, and penalties will begin for physicians who do not use electronic health records. If you're a primary care physician, an obstetrician, gynecologist, or a pediatrician, a regional extension center in your area will give you free services. If you're a specialist, you can get the same help selecting an EHR system at a very low cost. As you can see from Piqua Family Practice, the time is now to choose quality health care, patient records at your fingertips, a more cost-effective way to run your practice, and eventually a way to electronically exchange records with labs, other doctors, and hospitals throughout Ohio and beyond. Now is the time to choose, to save time, money, and lives. Together, we can improve the health of all Ohioans.